So today we're going to have a conversation about how COVID has been impacting behavioral health treatment, particularly for kids and their families. With this pandemic, we're seeing major changes in almost every line of practice, work, and business. From takeout-only restaurants now, called ghost restaurants, which I had not known before was the term, to online dance parties and virtual art museum tours. And one area that has really seen some changes is healthcare, and certainly behavioral healthcare. I remember when it wasn't too long ago that the idea of telehealth or virtual healthcare was really seen as an exception to the practice. It was not, particularly in behavioral health, it was not seen as a kind of, certainly not a routine approach to care. But today, out of necessity, the idea of treatment at a distance is much more widely accepted, and in fact, will likely thrive even post-pandemic. In the area of behavioral health for kids and their families, there is a treatment called intensive home-based treatment, or IHBT. Different communities or different states may refer to it under different initials, but essentially it's an intervention that is designed to address extremely challenging behaviors of youth within their home setting and community setting. And it's often seen as an alternative to removing youth from their home and residential placement. So Ohio has a long and very successful history of IHBT, and thousands of kids and their families have benefited from this treatment. The design of the service presents some very unique challenges to implementing it successfully in a pandemic environment. So today, to talk about those challenges, we have two terrific guests, Dr. Bobbi Beale from the Center for Innovative Practices at the Begun Center at Case Western Reserve University. Bobbi and I have talked before about this service and about trauma, and you can listen to those podcasts at www.wraparoundohio.org. Today's conversation will focus more on the implementation of IHBT within this pandemic reality. So Bobbi, always good to talk with you and see you.
Thank you, Patrick. It's good to be here.
So welcome. Also joining us today from Florida is Dr. Maurie Lung. Maurie is the founder and CEO of Life Adventures Counseling, which is a community-based organization that provides adventure-based mental health therapy and consulting. She has over 25 years of experience as a therapist, a business owner, an author, a speaker, a trainer, an evaluator, and university instructor. You'll be able to learn more about Maurie on our website that I just gave you, and you can learn more about her background and her organization. So Maurie, welcome to Ohio. I know you're getting to know our state pretty well, but we were really, really happy that you could join us today. So welcome.
Thank you. I'm happy to be here today.
Great. So Bobbi, do you want to say anything about, Florida, Ohio? That's like I-75, a lot of miles there. Any background about how you and Maurie became colleagues and friends?
Sure. We have in common an organization called the Association for Experiential Education. And gosh, a long time ago, Maurie, more than 10 years for sure, I hesitate to guess, when we started working on a committee together for research and evaluation of adventure programming. You know, that's always the catch, Patrick. You can have something that's just brilliant,
yep,
but if you don't have the data, what do you have? And so we were concerned and wanted to help move the field forward. And that was our first collaborative work together. We've both been in that organization for decades prior to that, frankly. I know I'm making us sound super old, but sorry, Mar.
Yeah, thanks.
But we really have known each other and have worked together for close to 20 years, I would say.
Cool. That's great. And, and I've certainly found, and obviously this is a good example, that a lot of our professional relationships and, merge into, personal friendships start that way, where you're working on something together and something clicks. And regardless of that adventure, you've kind of bonded as friends. So
We sure
it's
have.
great to have you both here. So since we've, I think, talked about IHBT a bit in previous iterations of this, but Bobbi, could you just kind of give us the, kind of the briefest overview so that we can just set the context of why this particular service is so challenging from a delivery point of view today, in today's world?
Well, it's right in the title, isn't it? Home-based.
Yep.
And we have been asked by our governor to not go into other people's homes. I know that that is lifting or has been lifted a little bit, and yet we understand with the pandemic, COVID-19 is super contagious. And when you share airspace with other people, meaning in their home environment, you're at risk. And frankly, as clinicians traveling around the county often, we could be carriers of the virus and going into people's homes. So even
Right.
if we felt okay, or if the family wanted us to come in, it's not the safest thing in the world to do right now. And we want to recognize that.
Right. So I'm curious, just in general, how have families responded to that kind of rather major shift in how they were relating to their therapists and program?
There's a giant continuum of responses,
Okay.
of course. And some families have literally fallen through the cracks because either they couldn't make the leap to doing stuff online, or they didn't have access to Wi-Fi or the technology to access that, all the way to some people are reporting they like it better.
Mm-hmm.
They like it better. They don't have somebody sitting in their living room looking around, and underneath it all, we're always thinking they're judging me. They're judging me if they're looking at me and my life, that sort of thing. Some teenagers in particular, the clients like connecting with people virtually, and we've been given permission really across the board from the Department of Medicaid and from OMAS to not just use telehealth, but all of the vehicles to stay in contact with our clients.
Mm-hmm.
So where it used to be, completely against the rules to text somebody, now we can do that sort of stuff, understanding that it's more important that we stay in contact than it is that we follow these previous rules about the kind of contact we have.
Right. And it is interesting. I have a good friend who's a therapist in a private practice, so she only sees people in office, but her client pool has moved to virtual, and she has said the same thing, and she specializes in seeing kids. She said the kids are, totally comfortable with it. They're just, zip right into it. So there are probably some advantages, from that perspective, relating to how kids today communicate so much of their lives. So, okay. So, so one of your roles, and certainly Maurie, your role too, as trainers and as consultants, what were your first reactions early on when COVID first kind of started, making the news? Past just, oh, it's interesting, it's in Washington, it's probably not, going to go anywhere else. When did you first begin to sense that, we need to be thinking maybe differently about some things? Maurie, how'd that first come to you?
Yeah, I think for me, because I also am an associate faculty at Prescott College, and our students are across the United States, globally too, but across the United States. And we have a lot of, the school is located in Arizona, and so we have a lot of students on the West Coast. So, you talked about like it started to pop up in Washington. I'm like, yeah, that's when I first started to get concerned, because I had students in the field impacted right away. So I generally, not only do I teach adventure therapy, I also supervise the internship class. And so even before it landed where I am in Florida, I had to work with interns who were talking to me about our services need to be different. My
Mm.
site's not letting us go in. How do we do this? So I think almost, to me, it felt almost immediate that it came to the forefront of my mind, and like, what the heck are we going to do?
Yeah. Yeah. Bobbi, what about you? Did it come a little later or about the same time?
Well, you probably know my boss,
Yeah, I do know your boss.
Dr. Rick Shepler. And he has a tendency to be alert to these sorts of concerns.
Good
He's
choice of words.
sensitive to contagion issues, shall we say. So we were hyper aware, I might say,
Yeah.
from before the governor's announcement here in Ohio. And we were watching it from the minute it landed in Seattle, and paying attention to what was going on. So thanks to Rick, I was probably aware in advance of some of the people here in Ohio. But honestly, my hat's off to Case Western Reserve University, and how proactive they were about saying, pack your stuff
Mm-hmm.
and get off campus if you can,
Yeah.
because this looks like it's going to be rough and it could take a while.
Yeah.
And I have a little one waving from a window.
Uh-huh.
And so we were aware pretty quickly. And the minute we could see that they were going to shut the state down that way, I was a little frantic about how in the world do we stay in touch with our workers, all the providers out there, and how do we help them help those families? And this isn't like elective surgeries that you can just say, well, let's just wait and see what happens.
Right.
These are people who are, pretty significantly chaotic, dysfunctional, struggling, challenged, already in a normal outdoor environment, in a normal sort of environment. These are people that it's a struggle.
Mm-hmm.
These families who were suddenly quarantined together, and lots of potential conflict and chaos for them. It's one thing for me to be quarantined in my lovely home with, a lot of family members, and we take care of each other, and we have a giant backyard that we can play in. How about these families who are living in much less spacious accommodations, and they're trapped with children who may or may not have mental health problems and are very difficult to manage their behaviors sometimes. And so being in quarantine instantly increases the stress. Sure. And when you have significant childhood trauma, as most of our clients do, you're going to be overreactive to these sorts of things anyway.
Yeah.
And so the problems I just could see instantly the problems were going to go up, and the solutions were being trapped because we couldn't get them. We couldn't be out there with them. Right. And so I wanted to reach out to all of our providers as quickly as I could to talk about what does this mean and what can happen.
Yeah, because I know your other immediate kind of reaction was, so how do we help an already kind of stressed workforce?
Right. Right. It's not like we have cushy jobs out there to start with and a ton of people helping. We're stretched pretty thin already. And it just got, it seemed like it was about to get 10 times harder.
Yeah. And I remember getting an email from you early on. It was to, CIP, Center for Innovative Practice group in general. But very early on, and you said, I don't think this is, just something typical here, a flu bug that's now going around. This is serious, and I suspect we're going to be shut down. And that was before the university, shut down. So I was like, ooh, that was kind of my wake-up call. Because again, I was, it was a distance from me. It was interesting to read about. I was intrigued. I was, slightly worried, but it felt not too much in front of me.
Mhm.
And then it did. So yeah, those early, flares went up. So
You
um,
know,
yeah, go ahead.
if I could, it's super interesting, the pandemic. As a
Mm,
clinical psychologist, this is the first and only thing in our lifetimes that have impacted the entirety of the world's
yeah,
human population.
yeah,
And we've never had something like that
yeah,
to deal with. I know there have been pandemics in the past. However, we didn't have the kind of social platforms and ability to be in contact and see what's happening in the other places at the same time. And this whole thing, it's a novel virus. It's a novel experience for humans
yeah,
to be in this situation. And so suddenly, on top of being concerned about the clients and how were they adjusting and dealing with it, and beleaguered workers and how were they going to help and take care of it, it was, we're all
right,
experiencing chronic traumatic stress,
right,
and it's inescapable. I say those words in training every other week, Patrick,
yeah.
that chronic stress is unrelenting, inescapable, and we have to help people. And suddenly I'm saying that about everyone.
And like you said, ourselves,
Yes.
what are we individually doing within our own personhood and our own families to not escape that, but to manage it and process, because there really is no escaping it. I mean, like you said, it's there, and you have to figure out your mechanisms to how do you process that in the best way, in the healthiest way. So I think as information about COVID began to, you know, kind of spiral the way the virus did, I think there was a pretty good recognition that this was not going to be short term, that this thing that was visiting us was going to be around for a while. So I'm assuming that's when you began, or prior to that, thinking about, so how are we going to respond long term, not just for the next month. You know, we can kind of maybe make do with some things if it, was something that was going to pass through and move on. But now we've learned that that's not the case. So talk a little bit about the strategies that you started to develop that were longer term. And Maurie, I know this is where particularly the skills and resources and talents of you and your organization came into play.
Well, actually, I'm going to back it up already to when my initial response hit. My instinct is to give people information. I'm a
Mhm.
trainer, I'm a consultant, and I want to put stuff out there. And so I quickly put together a webinar called Shifting Gears and Changing Minds, and to talk about just the things we just talked about. This is not just about clients. This is about all of us. And we're going to have to navigate this together.
Mhm.
And we also need to reach out and find our clients and make sure that they're being cared for and they know they have a lifeline or a connection. And so very early on, I contacted Maurie and said, Maurie, can you help me? Because as adventure therapists, we like to use experiential activities to
Right.
engage people and to learn things and to teach things. And so I call Maurie the activities lady. Very
Yay.
fondly, because if I have to go somewhere and talk to people or do something, I'm texting or calling her and saying,
Mhm.
what's a good activity for this?
Yeah.
And so it's not that I'm not also an adventure therapist, but she has this catalog in her head of just thousands of activities, and I love it and use it all the time. So I called Maurie early on and said, I'm going to do this Shifting Gears webinar. Can we give them a handful of activities that will help them engage with people on the phone and on the video so
Mhm.
that they can connect with their clients? Because it's going to be hard. This is going to be a heavy lift. And she jumped right in. And Dr. Scheffler was very supportive about putting this together because he thought it
Mhm.
sounded like a good idea. And so early on, we dabbled in some of our experiential and adventure therapy techniques.
Mhm.
And the minute we did that, we started having post-session conversations and saying, what else could we do? What else could we
Yeah.
do? They really ate that up. Is there
Yeah.
more? And that led to this 12-week series on virtual family adventure therapy. And when I posted it for the IHBT therapists and related people, including some of our other Center for Innovative Practice projects like Mobile Response Stabilization Services, MRSS, and the Engage project, we quickly hit our 300-person limit. That was a wake-up call to me on how much people appreciated and wanted our information. Because prior to that, Patrick, a good training was anywhere from 20 to 40 people. And so far exceeded that. And Maurie was on board with us to come up, how do you translate family sessions to a virtual thing without it just being talk therapy? And I hate to say that disparagingly, because I know there's a lot of talk therapists out there, but when you work with children and families, I think it's even more important to be interactive and engaging that way.
Yeah. I mean, talk therapy is a, wonderful tool. It's like any other tool. It's like, when do you use it and when's it best and for whom is it the most effective treatment? So yeah, you got to put all that in consideration. So Maurie, how did you respond to Bobbi's?
Yeah. Well, it's, Bobbi and I work together off and on here and there, but when I got that call from her, and how did you, Bobbi, phrase that the other day as we were reflecting on it? You're like frantically concerned. That frantically concerned. Bobbi doesn't usually get to that place of frantically concerned. So I'm like, oh, I think I need to attend to this. Like, what the heck is happening? And yeah, she calls me all the time for activities. And so yeah, sure, I can do that. And then it was like, when do you need this by? She goes, oh, the webinar's next week. I'm like, wait, what? Like we're doing this and it's already registered and here's where we're going. And so to me, there was that shift of like something else is happening. And as Bobbi was talking about earlier, when you're working with newer practitioners or interns, one of the things that we learn through school is that you're not supposed to do therapy with people that are experiencing the same thing that you're experiencing right now. Like, it's different if we've had it in our past and we've healed from it, there's lots of commonalities. But a lot of the newer practitioners don't even have any frame of reference or training about how do I do this at the same time? Yeah. And so to me, that was one of my bigger concerns too, is how do we meet families that are now in this unique environment, and how do we provide it for practitioners who are going to be experiencing it simultaneously? The piece that I love about adventure and experiential therapy is that it is a shared experience. It's a naturally shared experience. I do think that it's difficult for people to translate, how do I do an activity in the office where I can hand them supplies or I can, guide the behaviors. How do I do that when I have this screen in front of me? Yeah. And in my frame, I just think like, we all put limits on ourselves. Give me a moment. I can figure it out. Right? Like, I just say, like, I might need a few seconds here, but I'm sure that I can figure this out. And that response that we got to that very first webinar, where we were getting emails afterwards, like, can I do this with clients? Like, how did, what about this? What if I have a client? That need of, I need more than just having conversation. I do think talk therapy is great. Like, there's this piece about witnessing and story. When we're doing all of this telehealth, on top of clients that are already, especially during the spring, they were in virtual school. They're like, everything is happening through mostly Zoom. So you hear this Zoom fatigue, that we had to do something different other than just talking. So I think, Bobbi, you and I have been talking for, years. I don't want to admit how long that's been. Of like, we should do a family curriculum. So this put that pressure on. We need to do a family curriculum, and we need to figure out how to do this in an experiential way. So I feel like it was almost like just a week after that we were videotaping. It felt really fast, because there was like, I would create the curriculum, test it out on my family with my interns, a couple of clients. I'm like, let's go. We did, within a few weeks, get a week ahead, which was both great in terms of the testing. Like, I really did get to use it with my clients and my interns and see how that would go, so that I could tweak some of this, because we don't have a lot of frame of mind of how do you do this, electronically, what might you need to look at it differently, and then apply it, like turn right back around and apply it. And I think that not only was it the activities, it also provided that direct dialogue from here's what we've learned, here's some tips, try this out. And so that application part of it was a little bit different than just saying, hey, do this activity.
Right. Well, it makes me think about how similar that thinking and approach is to how the scientific and medical community have responded to COVID, which is we really don't know much about this. Let's try some things that at least there's some support that this may be a helpful thing. And then we either keep it on the list or we don't. But folks are in that mode of, we need to push the boundaries of, where our thinking has been about things and how to approach them. So, I mean, obviously with caution and all of that, but still, we obviously relying on the tried and true was not getting us where we needed to go. So, even the jumpstart to the research now, and looking at this virus and looking at potential therapies and potential vaccines, is way ahead of, I'm sure, any other previous disease we've ever dealt with. So yeah, people got to jump in and begin to think differently about that. So can you give us like kind of an example of something that therapists have particularly kind of glommed onto or particularly liked, or really the ramp up was like this, here it is, here's a really good activity, here's a really good intervention that seems to really make a difference?
Well, I think one of the differences was that we weren't just offering like, here's an activity. We created in this frame of this series. So based on where most families are right now in their experience of the pandemic, at the beginning, we're a little confused. In some ways, it's kind of nice. I don't have to drive the kids around, or, whatever was happening, or this part of how do we connect in relationship virtually. Like the whole series goes through this frame from this beginning part of connection and skill-based, shifting to problem solving and resiliency. It's all based on resiliency. So
Sure.
This is where I'm like really grateful that we do have, I'm not going to say how many years, lots of years of experience, because I think we were very thoughtful about integrating that structure of how we start off with a gathering activity to engage somebody, shifting to a check-in, which is practicing assessing ourselves and listening to others, moving into that piece of like this family toolkit meeting and how the family can collect like, where have we been, where are we going, some very skills-based activities. And that's where I think that people were really engaged, because how do I practice some of these ways in an interactive way? So that's where you're going to see the adventure therapy coming up. And so maybe we were working on some problem solving. And I think one of the activities I got a lot of feedback was I had the family stand on a hand towel, and their goal was to flip the hand towel upside down without stepping off of the towel or holding on to anything else. So they just have each other, and you have to flip the towel completely upside down. And so as we were talking about that and you're debriefing it, conversations about, I thought something was impossible and we made it work. We all had different ideas, and how did we come up with one idea to try? How did we support each other? And how do we support each other? What was stressful for somebody and what was not stressful for somebody? And when do we have to try something again? So all of these things come out from this, oh, we're going to flip a towel over. And just recognizing that depth and meaningfulness that can come from an experience versus what did you do last week and what might you do tomorrow? It's very in the moment.
Yes.
Which as me as a therapist then allows to observe in this moment. And I might say like, hey, I'm noticing that you're holding on to this other person. And as they are leaning over, what did it feel like to support your mom in that way? Or, just you can reinforce, and I guess Bobbi's one of her favorite phrases is rehearse, rehearse, rehearse. Reinforce and rehearse some of the things that we want to show up and highlight, particularly during this additionally chronic time. And then we ended with mindfulness. And mindfulness, you know, we know a lot of the research about mindfulness. It helps our clients, but it also helps us as practitioners, because you have to be doing this at the same time with your client.
Yeah.
And so I think it helped both of us. So we were very thoughtful in that structure, and that was an example of a particular activity. But
No, I
even the
think that,
structure creates routine.
yeah, no, I think that's a great example. I think it's a wonderful arc. I think about how just, our learning styles as human beings, that when we're more immersed in something and asked to invest more than just thinking about it, or just our thoughts about it, but having, like you said, to kind of physically move into a space with the challenge, and learn from that. So I think that's a terrific example. So Bobbi, where is the 12 weeks? Where are you in the 12-week?
Sadly, this Friday
Oh,
is week number 12.
okay.
Yeah.
So we're done. And I can't tell you, Maurie and I both admit to having feelings about this. It has been such an anchor for me throughout this leg of the pandemic, because now I realize how very much longer it's going on.
Yeah.
And I, every single week, I get emails from participants saying, thank you. This has not only been educational and helpful with my clients, but it's been an anchor for me throughout this, and it's something to look forward to each week. And I even have a small subset of this group who stays after the training video on training recording on Friday, and we do some mindfulness together so that they can get some more practice on doing and being able to teach mindfulness practices.
Nice.
And people are so grateful and are quick to point out how it's helping not only their clients but themselves. So it's been a very a super satisfying project, but I'm also very sad that it's ending, and we're already trying to think, what else like this can we do to keep supporting our folks?
Yeah.
At the moment, they're all considering going back into the community and into the homes. And I'm not in favor of that. We're watching the numbers climb, and I don't want them to be at more risk than they already are at, with the exception, Patrick, of crisis work.
Sure.
If it's life or death, if it's harm to self and others, then we might have to get our masks on and get face to face.
Yeah.
However, for the most part, if telehealth is working for a vast majority, adventure therapy is working for a lot of family therapists right here in Ohio. And I think we're onto something and should probably keep doing it until it truly is safe out there.
Well, I think y'all should be like Netflix and announce when season 2 is going to be available for download, because clearly you've hit on something that has really resonated. So seriously, is there thinking about maybe part 2, season 2?
We have several part 2s, and I'll let Maurie talk about those in a second, that we could consider rolling into. There are 3 big things that are impacting us during this pandemic. One is the illness itself and our concerns around that. And the second is the economy. And right now we don't have a budget, and today's the first day of the new budget year. And so it's really hard for the center to hire Maurie, for instance, to work with me to roll out another series, because we just don't know what's happening. Are we going to have cuts? Are we okay to go forward? Can we still hire consultants? We're frustrated. We're frustrated because I think we have some, all of us, not just Maurie and I, but everybody, Rick and Renee and Kim and Mike over at CIP are all saying, what are we allowed to do? We want to keep helping. But somebody turn us loose. Tell us we're okay to go.
Yeah, you're right. Today is day 1, at least in our state, of the new fiscal year. And as you know, the governor had asked agencies to provide budgets with 20% cuts, which is pretty substantial. And so we'll see where that It doesn't mean every department will be cut by 20%, but they were
Correct.
to at least show their efforts and how that was going to. But we're, beginning to hear and see where that's going to, impact. So that is definitely a factor. So, so we'll keep hopeful about that, and because it certainly feels and sounds like there's no lack of part two.
No, as a matter of fact, let's turn it over to Maurie for a minute and talk. We've talked about two potential extensions of this, and let's see what Maurie has up her sleeve.
You say that, I'm like, wait, what are the two potential things that we're talking about? We did do something kind of midstream where we did a series with individual sessions, because that feels really different than family sessions. So when you're working one-on-one with somebody, especially when it's just one-on-one and there's a computer, that shared experience is really different. And it is hard to rethink, how do you do these activities? So we did that part. The other part that I've been working on here that I think would be really relevant for Ohio, and maybe Bobbi, that's what you're talking about, is parenting sessions. So there's this other piece of, we have this family session, but with all of this stress and just the reality of how people are experiencing it, there's this part about how do our families work and play together. And let me just say that that's a really big part of our family curriculum, is this opportunity to play and laugh amidst all of this other piece. But there's been this other piece that I've had to work with the parents or caregivers individually, because there are pieces that they are dealing with and managing that's very different than the family component. And so to me, that's has been an extension and a difference, those two. Bobbi, were you thinking of something else?
No, it's the different applications. I wasn't even thinking about the individual one, because of course we did that along the way. And
right, because it's been a month since that.
Exactly. And boy, time warps in the pandemic, doesn't it?
It truly does.
But the other one was an extension of this, and moving. So our family's done and cured in 12 weeks of treatment? No, probably not, especially not our home-based folks. I mean, they have some really significant needs. And so do you just run through it a second time, or do you have a second series of things that you can do, that sort of thing? And so we have all sorts of ideas up our sleeves, but having the vehicle to present those we're waiting to see what's available.
And I am really grateful that we had some thoughtfulness we did a video that did all of the activities. So that is saved and stored. So it's not like this was this webinar and it was gone. So people can always refer back to the video of like, how does that work? As well as the written curriculum. And the live real-time webinar was really meant for more of coaching and how does this applying and what's happening with your families. And so we could make it more applicable, but that piece, like I thought that was an important piece, to have those variety of access points that will be there even when this was done.
So are those resources and tools available, Bobbi, to other folks who didn't get a chance to participate or are interested in that video or looking at the webinars?
This is an ongoing question and concern for people who do this kind of training. If we put all those videos out there and they didn't get our curated training that goes with them, can they really, do it justice?
I hear you.
And if I knew they were adventure therapists already, I'd be like, yeah, here it is. Here's how you translate it to online. But if you're talking about younger therapists or therapists who are unfamiliar with experiential practices, I'm really hesitant to just put them out there.
So we do have a few videos, right? Like we've done it, not with this series, but we've done a few things, a couple of the virtual ones that we put out there that were specific for therapists who haven't really done that work.
Yeah, and I totally get that. It's like there are things that we do that you definitely want to have that real time component to. So like you said, it isn't just saying, here, read this, or here's the workbook, or you have to contextualize it. You have to be able to kind of help people
And within this stress environment, because what happens within this stress environment is that we fall back on what's familiar. So
Yes.
even the people that were familiar with doing adventure therapy or experiential therapy initially, or those weeks that were particularly tough, they would do the check-in and the family meeting and the mindfulness, and they
Yeah.
would miss the experiential component because that part for more unfamiliar or scary. And so having that coaching or that nudging or like, this is why we want that there is a
Right.
component that helps us stay motivated when we're also experiencing this stress of, I want things to go back to the way that they were.
I would imagine that you might have been getting some feedback around people with perhaps their own ideas that's tapped into some of their own creativity as they've been exposed to this. Have you had any therapists that have said, oh, what about this? Or, I've never done this before, but now it makes me think about, something
While
else.
we do the live Friday session, we get a lot of action in the chat about, I
Ah,
tried it this way, or I didn't
uh-huh.
have a towel, so I used, those sorts of things.
Right.
And so you're getting some of that interplay with each other. Plus, we have a small percentage of those folks who are with us on Fridays or taking the live course who have had some adventure therapy training from me before in the state. In the state of Ohio, there's a project called the Ohio Adventure Therapy Coalition, and I've trained around 300 people, but not in one clump like we are right now,
Yeah.
all over the state. And usually these are partnerships between child welfare and behavioral health.
Okay.
And so we reached out to them as well as to the CIP listserv when we set this up so that we could get as many people out there as possible, helping as many families as possible. Frankly, it's all about reach for me and
Yeah.
whether or not we can help as many families as we can.
Yeah.
And some of the
Okay.
challenges were more about equipment challenges. And, so if I'm not bringing the supplies, what might a family have in the home?
Uh-huh.
We
Sure.
try to give some suggestions. And also application challenges, because although I might be at a computer, a lot of my families don't have computers. Like, so they were trying to do the video through a phone or through a, pad, and that's a little bit different. And
Yes.
so getting, how do you manage that? And so it really was more some of those logistical pieces
Yes.
that were then helpful for the group as a whole.
Yeah. Okay. Yeah. So kind of like a debrief about how'd that go for you and what I have to do to make it work. So I'm going to wrap up with two questions. One goes back to the very beginning of our discussion. This has to do with um, feedback, anecdotal information, data, lessons learned. Is that being cataloged anywhere? The idea of this is what we've, excuse me, not only accomplished, here are the trainings and the modules, but some sense of their impact. And I know this is not designed to be a study. I get that. I'm not asking about that. I'm asking about, have you been able to collect any, what feel like fairly substantive, lessons from practitioners and families?
Well, let me go first, and then we'll let Maurie respond more about the adventure therapy stuff. CIP has a group called the Supervisors Learning Collaborative. And when this all started to go down, and that group met quarterly and it has a listserv with a couple hundred people on it, not even quite a couple hundred people on it. And people in person would meet, again, 20 to 40 people would meet at the State Library in Columbus, that sort of thing. And when this started to go down, one of the needs that we heard from our community was, there's so much information coming in right now. We are not sure what we're supposed to be doing and who we're supposed to be listening to. It's overwhelming. And partly it's overwhelming because of COVID brain. We're
Right.
all stressed. And partly it's overwhelming because it was novel. It's all new. And partly it was overwhelming because it was coming from so many different directions. And so Rick really stepped up, as did the team, to try to filter information for people. And we set up 2 weekly meetings, one on Tuesday and one on Friday. And those are pretty regularly attended by a variety of people.
Okay.
So that was a way to So it's not data in the sense, Patrick, of collecting data with a, a program application
Right.
like Maurie and I are trying to do, but it was responding to needs while you're on the move. And what we were hearing was, help us understand and interpret what's coming at us so we're doing the right thing. These are really well-intentioned people wanting to do the right thing. And boy, there's a lot of information flying around out there, and a lot of it's not great. And so they needed somebody to curate that information. And that was a different kind of service responding to a different need.
Mm-hmm.
But that has proven to be very helpful as well.
Mm-hmm.
I hope that at some point we do have some data for this adventure therapy program that we put out there. And in the beginning, we prepped them for that by giving them a survey that they could use with their family pre and post.
Great.
Now, did anybody remember to do it? I don't know.
We'll see. You'll find out.
Collect it or respond. I feel like I have an advantage because I also have a small practice. So I also get to work with clients. So I got to hear my clients say like how helpful this was, or how they wish their schools were doing this, or, so I got really immediate feedback from my families about the importance of doing this. And of course I did the surveys because Bobbi, like if we're going to give a survey, I'm going to do the survey. So within my clientele, I saw that because I directly supervise interns that I was also having test this out. I got to see that too, about how their families that were willing to participate were doing much better than the families that either chose not to participate at all or tried to only do talk therapy. And how my interns were so much less stressed because the curriculum comes with, even has sample dialogue. It can be as scripted as it needs to be. And so when you're feeling stressed and I can't find that word, it's right there for you. And so my interns felt less stressed when they had appointments where they were doing adventure therapy versus talk therapy.
Okay, great.
So anecdotal, but I feel like we're starting to collect a little bit, and that's how you start to know, what do we test?
Right, exactly. So where I'd like to land is, so through all of these changes, and even some of the ones that have been more long-term, have you had any thoughts about how intensive in-home services, IHBT, other in-home services might be fundamentally changed going forward based on this experience? So when things, quote, go back to normal, whatever that might be, or whenever that might be, are there things from this experience that we will definitely say, we need to bring these forward? And maybe it reshapes a little bit how we define IHBT or intensive home-based services.
Well, I think the two topics that we can reflect upon with that are both the use of telehealth and the use of adventure.
Okay.
And in home-based treatment, there are fidelity requirements for both intensity and length of stay and all those things that you measure when you have a fidelity-based program. And sometimes providers struggle to meet the intensity. It's hard to be with a family who's very challenging and dysfunctional for 4 to 6 hours a week, which is kind of the average home-based kind of service. And I think that use of experiential techniques and seeing the huge variety of things that could happen in a session like that will expand their toolkit of things that they can do. And there'd be no reason to, if we get released to be in homes and it's safe, there'd be no reason to not use some of those things in person. And they may find that to be a super helpful tool. But on the telehealth side of things, I think that we're probably never going to be without parts of the telehealth. What would be the reason for not allowing telehealth now when we have, Patrick, in Ohio, one of our struggles is we have a lot of rural areas that are not full of master's level clinicians who can do their good work.
Right.
And so it's interesting that the project that Maurie and I did sprung out of the idea that we wanted a more curriculum-based family treatment that could be implemented by facilitators. They wouldn't have to be a master's level clinician if they went through the training and followed the curriculum. They can do these activities with people and it will improve their skills. And so we're going to go back to the table and think about that whole, help me, Patrick, FSPSA.
Yes, Family First Prevention Services Act. Yes.
Thank you.
Child welfare.
And so we think this is something, and Rick and I have talked about this for a year now. We think this is a potential thing that could be offered in as training in these more rural areas where they don't have enough workers. But then I also think, and they could have a master's level clinician checking in with them virtually. They don't have to live in that county. And so I think there are changes already happening. It'll be about will we have to fight, advocate for ourselves and our clients to be allowed to do some live and some virtual sessions, or is that going to just naturally evolve because of this experience? And again, the longer this lasts, the more likely it is that we move more permanently into telehealth. If they were to say, the virus is declining, where it's not going to come back, and this was this crazy 3 or 4 month period, we probably would be inclined to go back to business as usual. But because this is going to last for at least a year, I know people don't like to hear that, but because it's going to last that long or longer, I think we're all going to start shifting how we think about services to families.
Yeah, great.
I think it also increases the continuum of accessibility. And for many of the population that we work with that are marginalized or are lacking resources, this provides yet another way that we can connect in a meaningful way. And so I can't imagine, again, not wanting to implement it maybe as part of a bigger project or a bigger application of it. And I think it really helps.
Yeah. Well, thank you both, certainly for your time today, but more importantly for the great work you're doing and really seeing beyond, the barriers that this pandemic has created for us and figuring out ways to move through it and over it and around it. And I really appreciate your sharing your expertise and your thoughts. And we look forward to keeping this topic on the table in terms of how it evolves from here. So thanks.
Thank you,
Thank you.
Patrick. It was delightful to be here with you.